A good candidate for a penile implant is a man who has tried previous medical therapies and has either failed or suffered negative side effects from those treatments. This could be a man with diabetes, hypertension, peyronie's disease, or a prostate cancer survivor who has had surgery or radiation therapy for his prostate cancer. Most insurance plans, including Medicare, cover penile implants. It's also important to remember that should your insurance plan deny coverage, you have the right to appeal. There are a couple different penile implants available. The most common implant is an inflatable implant. This implant remains soft until the patient inflates the device using a small pump bulb in the scrotum, which transfers fluid from a reservoir into two cylinders that run down the shaft of the penis, creating an instant on-demand erection. The other implant that is good for patients that have less manual dexterity or want simplicity is a semi-rigid or malleable implant that stays hard all the time and is bent up when in use. There are some important differences between an inflatable and a malleable implant. The inflatable implant shown here has three components: a pump bulb in the scrotum, two cylinders that run down the shaft, and a reservoir that sits up underneath the belly. This allows the patient to control inflation and deflation and is flaccid when not in use. The malleable implant has no moving parts and is bent up and down as needed for immediate use. The inflatable penile implant is operated by the patient squeezing a bulb in the scrotum to transfer fluid from the reservoir into two cylinders that run down the shaft of the penis, creating an instant on-demand erection. Having a penile implant should not affect ejaculation or sensation. Whatever sensation or ejaculatory function you had prior to receiving the implant should be the same that you have with the implant. A penile implant is completely concealable underneath the skin. It offers a discreet option for men wanting an erection that is both spontaneous and reliable. The inflatable penile implant is made of a material called BioFlex, which offers a durable and sturdy material for the implant to function. The implant is filled with a solution of normal saline. A penile implant is a well-tolerated 45-minute outpatient procedure performed through a single incision at the upper aspect of the scrotum, through which all three components can be safely placed. Patients are able to go home the same day without a catheter and are ready to return to work within a couple of weeks. After a couple weeks of initial recovery after the procedure, patients can generally start using the implant within 4 to 6 weeks. The penile implant is ready to use within 4 to 6 weeks after the procedure. There have been a significant number of improvements over the years with penile implants, to where now we can expect penile implants to be quite durable over the long haul, lasting at least 15 to 20 years in most instances, and mechanical failure is extremely rare. Studies have shown that penile implants have the highest satisfaction rates of any erectile dysfunction treatments, with most men wishing they had done penile implant treatment sooner. A penile implant is a very safe and effective treatment option. As with any surgical procedures, there's a small but finite risk of infection or mechanical failure, but if performed in the hands of an experienced prosthetic surgeon, complication rates are extremely low.